Today's video is about how blood pressure is regulated in the kidneys and the impact of blood pressure enhancers on the kidneys. Please pay attention to the video if you are taking blood pressure lowering medications. Hello, this is K Health. There are various types of blood pressure enhancers, and once you start taking them, you will need to take them for a long period of time. Among them, there are certain ingredients that can cause problems for patients with chronic kidney disease, and there is a need for kidney function monitoring when taking long-term blood pressure enhancers, although the prescription will be determined by your doctor. It is important to mention that some people only realize they have chronic kidney disease after their kidney function has significantly deteriorated. Now let's take a look at how the kidneys are involved in blood pressure regulation. It may be a bit complicated, but you don't need to memorize everything, so feel free to relax and listen. When blood pressure drops, the kidneys release an enzyme called renin into the bloodstream. Renin, produced in the liver, converts a protein called angiotensinogen, which is released into the bloodstream, into angiotensin I. Angiotensin I is primarily converted into angiotensin I, a potent vasoconstrictor that raises blood pressure by an enzyme called ACE found mainly in the lungs. Angiotensin I stimulates the release of a hormone called aldosterone from the adrenal glands, which increases the reabsorption of sodium and water in the kidneys, thereby increasing blood volume and blood pressure. Angiotensin I also stimulates the release of antidiuretic hormone, I, from the hypothalamus, which prevents the excretion of water, further increasing blood volume and blood pressure. This renin-angiotensin system regulates blood pressure. It may have been a bit difficult to understand, but you don't need to know everything. The important thing is that the kidneys are directly involved in blood pressure regulation. Blood pressure enhancers that can affect the kidneys are medications that primarily have diuretic effects to lower blood pressure. Among them, there are certain ingredients that should not be taken by patients with advanced chronic kidney disease, as they can interfere with potassium excretion. One of these ingredients is spironolactone, which is also known by the brand name Aldactone. Although it is mentioned as a blood pressure enhancer, there are many effective blood pressure enhancers available. So spironolactone is mainly used to reduce edema in conditions such as congestive heart failure or cirrhosis. However, this ingredient has the characteristic of potassium retention. There is a risk of life-threatening hyperkalemia if you consume foods high in potassium or take potassium supplements while using it. It can be extremely dangerous for individuals with impaired potassium excretion due to advanced chronic kidney disease. Furosemide, commonly known as Lasix, is a powerful loop diuretic that also lowers blood pressure, so it is classified in that category, but it is mostly used as a medication to reduce edema. It was once a problem due to misuse, but now it is designated as a drug to prevent misuse. It is also widely used in cases of edema caused by chronic kidney disease. Unlike spironolactone mentioned earlier, Lasix promotes potassium excretion. Therefore, in practice, Lasix and spironolactone are often used together to counteract the effects on potassium. It can cause imbalances in fluid and electrolytes, so it should be appropriately and carefully used under the monitoring of a doctor. However, there are people who inappropriately misuse Lasix, even though it was prescribed to reduce edema for non-medical purposes. So caution should be exercised to avoid such situation. In addition, among diuretics, the most commonly used ingredient for the purpose of blood pressure enhancement is hydrochlorothiazide. It is often used as a single ingredient, but recently, it is included in many combination products due to its cost-effectiveness. However, in older adults, the rapid diuretic effect can lead to dehydration and decreased blood volume, which can cause blood clots or a decrease in blood flow to the kidneys, resulting in impaired kidney function. If you experience persistent thirst after taking the medication, you should discuss this with your primary care physician. It is also contraindicated for patients with severe renal failure. Secondly, blood pressure enhancers that affect the kidneys are ACE inhibitors and ARBs, which are angiotensin receptor blockers. These medications are involved in the renin-angiotensin system that was mentioned earlier. These medications have both positive and negative effects. Both ACE inhibitors and ARBs have renal protective effects in patients with heart failure. ACE inhibitors include medications such as captopril, enalapril, and ramipril. But recently, ARBs have become overwhelmingly more popular due to side effects such as cough. Some examples of ARBs include losartan, valsartan, and telmisartan. There are too many brand names to mention, so please understand. However, ACE inhibitors, in addition to cough as a side effect, can also cause hyperkalemia. Aldosterone increases potassium excretion, but ACE inhibitors affect aldosterone. So ultimately, potassium may not be excreted and can accumulate. Of course, not everyone will have a problem, but for those who develop hyperkalemia, it is advisable to monitor them in advance. It seems that ACE inhibitors have various side effects. Consequently, the mainstream of prescription has shifted to ARBs, which are angiotensin receptor blockers. They have fewer side effects, effectively lower blood pressure, and also have renal protective effects. So there is no reason not to switch to them. The most representative one is losartan, also known as Cozar. The brand name for telmisartan is Macardis. This medication has been shown to have a better effect on reducing proteinuria in patients with diabetes-related chronic heart disease. However, this medication with good renal protective effects can also, in some cases, cause acute renal failure. Both ACE inhibitors and ARBs dilate the efferent arterioles of the kidneys, reducing glomerular pressure and protecting the kidneys. However, regardless of age or other factors, atherosclerosis can occur in the renal arteries. If the renal arteries become narrowed or constricted due to atherosclerosis, the incoming blood volume is reduced, while the outflow volume remains the same. This leads to a state of low blood flow and low blood pressure within the glomerulus, which can actually lead to heart failure. It has been reported that 34% of elderly patients with renal failure have renal artery stenosis. Initially, ACE inhibitors or ARBs take about 4 weeks to show their effects. In terms of blood pressure regulation, it means that it takes a long time for the initial efficacy to become apparent. However, in this case, the blood pressure dropped significantly and normalized within just 3 days of starting the medication. Instead of simply attributing the excellent effect of the medication, we should consider the possibility of renal artery stenosis. Furthermore, when taking such blood pressure enhancers, caution should be exercised to prevent the development of atherosclerosis, which can undermine renal protection. In atherosclerosis, the main culprit that damages blood vessel is inflammation, not cholesterol. To prevent it, reduce the intake of refined sugars, such as fructose, and manage stress effectively. Additionally, when elderly individuals contract COVID-19, they often die from organ failure, including renal failure. This is because the COVID-19 virus directly causes inflammation in blood vessel. So be extremely cautious and take precautions against the inflammatory monster called COVID-19 until the end. Please subscribe and like. I request your support. See you next time. Stay happy.